They recruited 50 women, and they were found to have depression, treated with bioidentical estrogen. Their conclusion, they had a remission rate of about 68% remission rate in depression in the estrogen-treated group, and interesting, they had a 20% remission in the placebo group, which shows you the power of a placebo. But certainly the estrogen did far better, 68% versus 20%. Their conclusion in the Archives of Psychiatry 01, transdermal estradiol replacement, that's a bioidentical estrogen hormone, is an effective treatment of depression for perimenopausal women. So this is the mainstream psychiatry literature. And my statement and my feeling is that the use of SSRI antidepressants for menopausal mood disorder, depression, anxiety, is a form of misdiagnosis. It's a form of mistreatment, and it should be halted immediately. All of these women should be receiving a bioidentical hormone supplementation. We briefly touched on menopausal arthritis. This is the aches and pains in the joints that women develop after the age of 50, postmenopausal arthritis. And it's caused by declining hormone levels. It's caused by low estrogen levels. How do we know that? Well, there are numerous studies in which women are given estrogen-blocking drugs, and this information is then reported. For example, there's a drug which is called an aromatase inhibitor, which blocks the conversion of testosterone to estrogen in women. It's commonly used in women with breast cancer to produce estrogen blocking. It blocks the amount of estrogen that they're able to produce, and it makes low estrogen levels. This is entitled Aromatase Inhibitor-Associated Arthralgia Syndrome by Dr. Bernstein of the Dana-Farber Cancer Institute, Boston, Massachusetts, published in the journal Breast, 2007, mainstream medical journal. And this is what the author says, I'm quoting. Low levels of estrogen achieved with a drug which inhibits aromatase enzyme. The name of the drug is anastrozole. It's also called Arimidex. These are commonly used drugs to block estrogen in women. The low levels of estrogen achieved with these drugs cause accelerated bone loss with risk of osteoporotic fracture. Now remember, we saw from the Women's Health Initiative study, the second arm, how bone fracture was reduced by 40%. Now here's the other side of the coin. When we block estrogen, we have accelerated bone loss and increased fracture. The Women's Health Initiative showed that giving women estrogen reduces fracture rate 40%. Here we have a study that shows that blocking estrogen or making producing low estrogen levels in the body causes accelerated bone loss and accelerated osteoporotic fracture. The author goes on to say, and I'm quoting, clinical experience shows that aromatase inhibition therapy, which means estrogen deprivation therapy, is associated with an arthralgia syndrome. Arthralgia means aches and pains in the muscles and joints. Such symptoms are quite prevalent and can be a reason for discontinuing the treatment pill. So this is very well known, very well described in the medical literature, and we also see this quite commonly in clinical practice. Women who have aches and pains in their joints come in. They're found to be estrogen deficient on lab testing. They're supposed to they usually also have additional symptoms of menopausal estrogen deficiency, such as the hot flashes, night sweats, and when they're given estrogen supplementation, of course, it's given along with the proper amount of progesterone. Estrogen and progesterone are given together. But the estrogen levels go up and their aches and pains go away. One of the things estrogen deficiency will do is estrogen is anti-inflammatory, and estrogen deficiency in the body produces a generalized inflammatory condition, which causes, inflammation causes aches and pains in the joints, muscles. And the estrogen supplementation relieves that generalized inflammatory condition. additional studies which support the the concept of estrogen deficiency and arthritis were published in 2005 in Arthritis Rheumatism, or the rheumatology literature. And again, they looked at aromatase inhibitors and arthralgias with estrogen deprivation. This is published by Dr. Felsen and Cummings. Another study in Lancet Oncology in 2008 looked again at the same thing, joint symptoms in patients on estrogen blocking drugs. Another important finding that we see commonly in clinical practice is that estrogen deficiency, postmenopausal women with estrogen deficiency will develop osteoarthritis over a long period of time. And again, that's because the joints require collagen, which is our most abundant protein in the body. And if we're unable to make collagen, we cannot make collagen, then the joints will, over time, gradually degenerate and develop what's called osteoarthritis. And eventually, if it gets bad enough, we'll need a joint replacement. But in order to prevent and reverse the onset of osteoarthritis, we have bioidentical hormones. We have estrogen. How do we know this is true? We'll take a look at a study done at Rush Medical College, where I went to medical school. This was published in July of 2002 in Chicago, Illinois, by Dr. Kimberly. This was published in the journal Arthritis and Rheumatism, a mainstream rheumatology journal. Their article is entitled Effects of Long-Term Estrogen Replacement Therapy on Osteoarthritis Severity in Monkeys. They studied osteoarthritis in monkeys who genetically are very similar to humans, and we can extrapolate that to us humans. What they did was they divided their treatment group into two groups. One group received a placebo. These were female monkeys. One group received estrogen replacement, and the other group received a placebo, and they followed them for 3 years. At the end of 3 years, the monkeys were sacrificed, and they actually looked at the knee joints histologically with microscopes, meaning they looked at histology slides, little microscopic slides of the cartilage in the knee joints. And what they found was that the cartilage lesions of osteoarthritis were significantly less severe in the animals given estrogen replacement therapy compared to those given placebo, in other words, the control group. And I'm quoting the author. In summary, the results of the present study demonstrate that long-term estrogen replacement therapy decreases the articular cartilage lesions of knee osteoarthritis in their monkey population. The authors go on to say, and this is very important, this is Dr. Kimberly of Rush Medical College. That's where I went to medical school in Chicago, Illinois. This was published in 2002. They go on to say, previous studies in humans show that postmenopausal women taking estrogen replacement therapy have a lower prevalence of osteoarthritis. And they list the publication of the studies that show that. They go on to say, this provides strong argument that hormone replacement may be a simple way to decrease severity of osteoarthritis in estrogen-deficient women, which is exactly what I'm saying. It's exactly the point that I'm making, is that we now have a simple and efficient way to prevent and reverse, to some extent, osteoarthritis in estrogen-deficient women, which means all postmenopausal women are estrogen-deficient. So we have 50 million postmenopausal women who are slowly, gradually developing osteoarthritis and other forms of degenerative disease. Here we're focusing on osteoarthritis as the degeneration of the collagen in the joints. And this is a mainstream medical journal author saying that there's a strong argument for hormone replacement as a simple way to decrease severity of osteoarthritis in postmenopausal estrogen-deficient women. In addition to reducing So in addition to reducing the risk of osteoarthritis, as we know, it also reduces the risk of osteoporosis and atherosclerotic heart disease. So the degenerative disease, according to this author, they're focusing on degeneration of the joints, the bones, and in the coronary arteries, and they are recommending bioidentical hormone replacement in a mainstream medical journal. So the take-home message, if you're thinking about staying healthy after the age of 50, you've got to be considering bioidentical hormone replacement. If you're thinking about hormone replacement, I would strongly recommend that you use human bioidentical hormones. The evidence is now overwhelming that they're safer and more effective than the synthetic chemically altered hormones. Smart women have made the switch to bioidenticals, and I would suggest that you work closely with a knowledgeable physician. Give us a call. This is what we do in our office. Until next time, this is Dr. Jeffrey Dach signing off and asking you to stay healthy.